A common question I get asked in my office when I'm seeing patients and treating patients is, what is the difference between a Jones fracture and a pseudo-Jones fracture? They're treated very differently, and it's really important that you diagnose them correctly, because if you don't, it can result in a non-union and a long delay with the patient getting back to their normal activities. I'm going to show you an x-ray of a pseudo-Jones, or what I would like to call the base of the fifth metatarsal fracture. The fracture is in the metaphyseal region, which is this wide region of the bone. This is the diaphyseal region of the bone. This portion of the bone has a great blood supply. So almost every single fracture in this region will heal without surgical intervention. There is a watershed area right here where there's just not very good blood supply. And that is where it's very hard to get a fracture to heal. And that is called a Jones fracture. So if you look over here, this is the area where a Jones fracture starts. You can see on this film also, this is where a Jones fracture is. So going back here, this is the metaphyseal region, tons of blood supply. Bone heals, no issue. But from here to here, if you get a broken bone, it's called a Jones fracture, and it doesn't heal very well. Here's another image of a Jones fracture. It's in the diaphyseal region of the bone. Remember, the diaphysis is the thin, narrow portion of the bone. The metaphysis is the wide portion. And the way I remembered that in medical school is metaphysis is an M, which is a wide letter. Diaphysis starts with a D, which is a narrow letter, if you want a little mnemonic. I'm going to have you kind of flip this in your brain. This is the metaphysis. This is the diaphysis. And this is the diaphyseal region of the bone. And this is where it doesn't heal very well. This area will heal very well. So this is a zone 1. Zone 2 is a Jones fracture. And zone 3 is an area where the bone doesn't heal very well either. This is a great anatomical classification. It's called the TORG anatomical classification. Zone 1, which is right at the base of the metatarsal in the metaphyseal area, also known as a pseudo-Jones fracture, heals great. You almost never, ever, ever have to do surgery on that particular fracture. Zone 2, which is in the diaphyseal region, is a Jones fracture. And that is a vascular watershed area that does not heal very well and has a non-union rate up to 30%. Zone 3, which is further distal down the fifth metatarsal, also has not a great area of blood supply, so there's an increased risk of non-union. Good summary here of how to treat this. And you may want to just take a screenshot of this particular slide. Zone 1, we put in a boot. We almost treat, I like to say, with benign neglect. Zone 2, non-weight bearing. Look at this, non-weight bearing for 6 to 8 weeks. If they are a high level athlete, a zone 2, we may just move straight with putting a screw in that area because of the risk of non-union. Zone 3, fairly similar treatment to a zone 2. When you're looking at your x-ray, if the fracture is in the metaphyseal area, that big wide area, great blood supply, they heal without issue, put them in a boot. I let them walk on it as soon as they are not having much pain in the boot. Zone 2, immediately make them non-weight bearing, 6 to 8 weeks. If you have a high level athlete, or you have somebody that has to get back to their job right away in a labor type position, considering putting in an intramedullary screw to fix that particular fracture. Zone 3, which is just a little bit more distal than a zone 2, you would fix similarly.